Hello friends, 11th April is celebrated as World Parkinson's Day, and the entire month of April is dedicated towards creating awareness about Parkinson's disease. In this context, this video was developed so that many people will become aware of this condition, detect it early, and will be able to take the right steps at the right time. Parkinson's disease generally occurs in persons above the age of 60 years. Very rarely it is seen under the age of 60. First, let us understand how Parkinson's disease occurs. This condition occurs when nerve cells in certain areas of the brain get affected and begin to die gradually. This leads to a reduction in a very important chemical in the brain, which is essential for controlling the body movements. Due to this reduction, the muscles may become very stiff or tight, leading to slow movements. Consequently, persons with Parkinson's disease may find it difficult to carry out even routine basic day-to-day activities such as dressing, bathing, etc. Their body may be bent forward and they may find it very difficult to balance against gravity, and they may have a tendency to fall. They may take very short steps while walking with limited hand movements. Also, there could be shaking of the limbs, particularly the hands or the fingers. Just as there is stiffness in the entire body, the muscles of the face, mouth and neck can also become stiff, which can have an impact on speech. The jaw, lips, tongue and various other structures which are important in speaking may move slowly, leading to unclear speech. The voice may become low and the person may speak softly. The eating and drinking can also get affected, and sometimes swallowing can also get impaired. All these changes happen anytime after the onset of the condition, but gradually increases as the disease progresses. All of these changes ultimately affect the person's quality of life. If any of these problems are seen, it is wise to consult a neurologist as early as possible so that a diagnosis can be made and the medical line of treatment can be initiated. However, it is equally important to consult other healthcare professionals such as speech-language pathologist, physiotherapist, occupational therapist, and several others. A speech-language pathologist will help them to improve their speech and help them to communicate effectively through speech therapy. They will also help in improving their eating, drinking, and swallowing ability. A physiotherapist will help in improving the movements of the body, facilitating flexibility, while an occupational therapist will help in improving the body functions that are required to carry out the day-to-day activities. If you find anyone experiencing these symptoms, please refer them to the right professionals. The services for such persons are also available at the All India Institute of Speech and Hearing. There is also a dedicated helpline for persons with Parkinson's disease and their caregivers to avail teleservices through the website displayed here. For further details or for any further queries, kindly contact the address provided. Let us all do our bit towards this noble cause.